Hi, good day. So my name is Martijn Kelder, and I'm the Strategic Account Manager here at Cergentis. It's been a while since we spoke at BPI, so we thought it would be of use to you to learn more about the updates in our offerings and how TLA is nowadays being used in cell line development and cell bank characterization. So just to jump straight in, so genetic characterization of a cell line is a regulatory requirement, especially at the master cell bank stage, but also down the line, looking at your working cell bank and your end of production cell line. And hereby it's important to look at the integrity of your transgene, where has the transgene integrated, and the number of transgene copies. And if we then look more broadly, you also want to look at the clonality and the genetic stability of a cell line. And all of this, if we look on a sort of broader scale, is expected to sort of guarantee that the quality and consistency of your produced biological, say your antibody, is maintained and guaranteed. So you want to see on the genetic level, but also of course on the phenotypic level, on the quality of your product, that this is consistent throughout your entire production process. So there's a few characteristics and criteria that are typically of interest to our customers. So looking at, for example, the integration sites, whether any structural variants have occurred due to your transgene, whether there's any co-integrations of foreign bacterial DNA, and looking at the integrity of your vector as well as the copy number. So there's a few technologies that we say are conventional quality control technologies for genetic characterization. So for example, Southern Blot and FISH, but none of these technologies in a single assay capture all of the characteristics that are of interest to yourself and the regulatory authorities. So for example, with FISH, you might determine where your transgene is integrated into your genome, but it doesn't say anything about vector integrity. So you will always have to deploy several technologies, and many of these technologies will take perhaps 10-15 weeks to be performed and may take tens of thousands of US dollars per assay. So INCOPS TLA, and with that it deploys a single technology that will immediately capture all of the characteristics that are of interest in genetically characterizing a cell line. So looking, where is your transgene integrated? How is it integrated? Are there any mutations in my transgene? And what is the copy number? Importantly, this can be done within a matter of weeks. In-house, it can be done within 7 days. And it's less than 2,000 US dollars per assay. So this is not just us saying this, but we have been around since 2012, and ever since we've been supporting all leading pharmaceutical companies in their cell line development work, both in CHO cell line development and in cell and gene therapy more recently. There have been dozens of leading pharmaceutical companies supporting, publishing on the use of TLA in their cell line development work, and both with leading pharma and leading contract manufacturers, we have been publishing application notes on the use of TLA in their work. So there have been dozens of peer-reviewed publications on the added value of TLA to the work in genetically engineered models and cell lines. And we have been mostly working as a service provider. So our facility performs all the TLA work for our customers in close collaboration with our customers through our dedicated team of PhD level scientists who are very knowledgeable and have seen hundreds of to thousands of CHO samples and cell lines in the last few years. In this presentation, I'm not going to go into the details of our TLA technology and how it exactly works. If you're interested in that, I would like to refer to this proof of principle paper from Nature Biotech in 2014, or to our website where we have several webinars and application notes on our TLA technology. But I'd just like to say that we base our TLA technology on the fact that DNA that's on the same locus, on the same strand, is also often in the 3D conformation of the cell in close proximity to each other. With a single primer pair, a single TLA primer pair, we can amplify an entire 100 kb, so 100,000 bases of your integration sites. And it's an enrichment technology that will readily allow you to sequence these reads and loci with any NGS technology. So whether it's Illumina or PacBio sequencing, for example, and it's suitable for multiplexing, meaning that if you want to look at, for example, different vectors being integrated into the same sample, we can readily do that by just adding a few more primer pairs. So one of the key advantages is that we can, in a single go, like for example with FISH, we can show where your transgene is integrated. So here you see genome-wide coverage plots. Of course, with CHO, we don't work with chromosomes, but with scaffolds. So here you see you have a single or multiple integration sites immediately being depicted in respectively the left and right panel. Besides the genome-wide coverage plots, TLA generates very, very high coverage over thousands of times of reads on each position, which allow us to very reliably determine the exact breakpoint read, so the exact integration site on a single nucleotide level. And similarly, what we can do is that if you have multiple copies integrated at a single site, we can in one go determine these concatemers and see whether, for example, any partial transgene copies are present. That might lead, of course, to aberrant proteins being expressed. We can look at co-integrations either of multiple vectors or look at co-integration of the E. coli sequences. Of course, this is optional, but it is something we do for some of our customers, and we have observed in both mice but also in CHO cell lines, which might affect your production. So TLA can detect large or small structural variants. So normally you get a typical bell-shaped profile. Again, I won't go into the nitty-gritty of our technology, but if you have a structural variant, say a deletion, you would see a gap in sequence coverage, or if you have a translocation, you would see an abrupt ending of a peak, which would contain another chromosome scaffold. Importantly, also for looking at transgene integrity, we can immediately see with this technology, because we cover each position thousands and thousands of times, determine any single nucleotide variants that might, of course, affect your eventual biological. So we can exactly determine where in your transgene or vector in your gene of interest, for example, the position is of the mutation, which mutation we observe, and we always use two data sets that will independently call all the variants. And if you have multiple samples, say multiple clones from the same batch, we can in a single go determine whether these variants are happening across the board, which might indicate that these variants are already present in your plasmid at the beginning, or that these variants are specific for example, a clone. We standard have a 5% threshold, but we can go as low as 1% with confidence. So in summary, so TLA outputs all genetic characterizations of your cell line. So the integration sites, transgene integrity, and based on the number of concatemers and the number of integration sites, we can also determine the transgene copy number. So that's in brief our TLA technology and its output. I will now go further into the applications of TLA in CHO cell line development. So there's several stages at which TLA is of use. So I'm just going to go briefly through all these stages. So very much upstream, when you do transfection, you might be interested in determining whether there's any hotspots in your cell line, whether integrations of, say, if you have a single integration, whether these are clean. And so especially when you have new transfection technologies, you want to assay looking at the genetic level, and the genetic integrity can be very, very valuable. Similarly, we can look at heterogeneous pools. So now you might, for example, if you have two pools, one with high producer cell lines, one with low producer cell lines, you can compare the two in a single go using TLA and see whether there's any characteristics in the integration sites. So TLA is being used a lot in clone selection and cell bank characterization at the MTB stage. Whereby, of course, you are interested in the number of integration sites, vector integrity, and looking whether there's any structural variants surrounding the integration sites. There's a few applications for which we often support our customers. I've just listed a few here. So, for example, with random integration sites, our customers often assume that these are random, but how random are these indeed? Often it's not uncommon that we see multiple clones being submitted that are thought to be unique, but that through TLA we see that through random integration, all of these, several of these clones have exactly the same integration sites, indicating that these are from the same origin. So that's quite unfortunate if you put all the effort into maintaining these cell lines that are considered to be, or clones that are considered to be unique, whereas actually they're identical. It's interesting for us to see that although many of these plasmids have been linearized, the breakpoint actually often does not occur exactly on the linearization sites, which, as you may consider, might affect your final production. And looking at, for example, multiple vectors, we can look with TLA at whether there's shared or unique integration sites. And of course, when you look into the production of more complex molecules, which of course are now increasingly in demand, there is, of course, it would be of interest to assess the unique integration sites of the different, say, LC or HC vectors, which will be very difficult for probe design for Southern Blot or FISH. This is something that TLA is very good at analyzing. For example, looking at transposon-mediated integrations, when analyzing those, we often see that the integrations are not as clean as one would expect. So, for example, we would see a backbone integration of multiple copies being integrated at a single site, which of course is something that is undesired. And there's also been a surge in the number of samples we've been analyzing with landing pads. So, for example, with that, you want to ideally create a single integration site, a hotspot that you know production will be high. And once it works, you can rapidly insert the transgene. Of course, then you might sort of get away with not doing any downstream characterizations anymore. Of course, yeah, we see that this is being done a lot by a lot of pharma cell line development groups, whereby it's not uncommon to see incomplete or incomplete recombinations and sort of downstream integrations into the landing pads, which will of course be very hard to resolve with, for example, FISH, which is something we have a lot of experience with. Targeted integrations, this is what we routinely analyze in our transgenic models over hotspots, integrating landing pads, of course, whereby we can, with TLA, assess potential of targets, the quality, the QC of the on-target efficiency, and whether single or multiple copies have integrated. And then sometimes in CHO we see some lentiviral integrations, whereby again we can look at backbone integration or concatemerization. So Novartis has published last year on the use of our TLA kits for in-house clone selection. So they described that they can go from cell up to the report needed to determine which clones to continue with on the genetic level with TLA within 7 working days. As mentioned, we do a lot of characterizations of cell banks, and we've been supporting a lot of our customers in this efforts. And so TLA data has been used, to our knowledge, in several successful IND and NDA filings, um, and especially for CHO cell lines. And for example, looking at these efforts, we can, as Cergentis, offer a full report. So standard reporting is just a sort of summary. We can do extended reporting that meets the FDA expectations and that can go readily into a filing. And just a few slides on the use of TLA in assessing clonality and genetic stability. So then on clonality, so this is of course a topic that has gained a lot of interest over the last few years. This is again a regulatory requirement. I've just listed a few quotes here for some of the guidelines by the FDA and EMA. Of course, nowadays, if you generate a cell line, one typically obtains high throughput imaging from the effect sorting. You can have these single cell printers, but especially for legacy cell lines that have perhaps been generated a decade ago or even longer, then if you don't have this supportive data, and you want to submit your cell line, you still have to get some of this data into your filing. And then one option, of course, is to do 2 rounds of limited dilutions. But as you all know, that's very time costly. And of course, if you rederive your cell line, that might affect all your media formulations and importantly, the production. And so especially when you want to do your filing, time is of the essence. So it would be ideal if you could, without having to rederive your cell line, obtain the information necessary for this. And of course, all this information is eventually to obtain that you've done everything in the best of your interest to ensure that you've got a consistent and high quality production of your biological. So TLA can be used to assure clonality. What previously Glenmark has published and what we very recently have published in combination with Novartis is on the use of TLA. So as mentioned, we obtain on a single nucleotide level integration site information on the breakpoint. So these are, especially when you do random integrations, these are considered to be unique signatures to your clone. And so what we can then do is once we've done a thorough assessment by TLA of your master cell bank, downstream we can use these reads to design qPCR probes, and we can then on a large number of subclones do qPCRs across several of these breakpoint reads. And if all of these are positive for these reads, that will give a very high assurance of clonality. If there's any abnormalities, what we can do is then we can perform a full TLA analysis of some of these subclones to further argument the likelihood of your cell line being clonal. So what we currently offer is a clonality assurance package, which consists of the full genetic characterization of your master cell bank by TLA, and as I just mentioned, a qPCR-based analysis of high number of subclones, by default 93. One side note there is that we would require our customers to provide these subclones, as we don't currently have any culturing facilities, although we can set you up with a third party to have this done for yourself. And as I mentioned, as all of these clones will be positive, we will get a very, very high assurance of your cell line being clonal. And we will write this into an extended report that will meet FDA expectations. And this can be done within 10 weeks. So that's a lot faster than when you were to do several rounds of limited dilution. And it will give you very highly reliable data on the single nucleotide level of your cell line being clonal. And of course, you cannot prove clonality, but the regulatory authorities want you to do everything to the best of your efforts to assure that your cell line and your production is consistent, So this will be very powerful supporting data in assessing clonality. Ensuring consistency of your production over time also has to occur on the genetic level. It's a regulatory requirement. And again, this can be performed by TLA, and actually we do this work a lot for our customers, either pre-GMP or in the production phase, looking, for example, the master cell bank, working cell bank, and a production cell line. We can do this in 4 weeks. And that's, of course, if you are planning to submit your cell line or your product, that is a very convenient timeline to work with. And we do this a lot for our customers, so we can do full extended reporting that is meeting expectations from the regulatory authorities, and we have a lot of experience in this regard. And this has been described also by Brian Mickes from Gilead already 4 years ago. If you have any questions on this, we can readily support you in setting up a project for you. So I'd just like to recap that TLA provides all the genetic characterization, all the information needed in support of your filing. So all the integration sites, transgene integrity, and copy number. And it can drastically reduce clone selection timelines for a highly competitive price compared to, for example, FISH and Southern Blot. And because of that, it's a widely used and widely accepted assay, both by the regulatory authorities as well as leading pharma and CROs. TLA is available in different flavors, so either as assays for clone selection, cell bank characterization, such as MCB characterization, clonality, and genetic stability. And it's available in 2 options roughly. So either as a service, meaning that you submit the samples to us, and within 4 to 8 weeks, we provide you with detailed reports for less than $2,000 per sample. Or alternatively, we can provide you with a kit, sort of DIY kit, that will allow you to perform TLA in-house, which can either be manually or automatically performed, for which we will soon release a clickable analysis software package. And Novartis has published that they can obtain data from clones to sequencing data within 7 working days for a very highly competitive price of around $400 per sample. So hopefully this presentation was of interest. If you have any more questions, please feel free to email me on the email address shown, or I would happily answer any questions in the Q&A.